Hi, Christy. Kim Ray here to tell you about some exciting technology in the field of music therapy called SoundBeam. Let me show you a picture of it. This is the SoundBeam system. You see two speakers, two receivers, the SoundBeam board, and then these are some touch pads. Now, this really isn't new technology, but SoundBeam has made a system that's portable, so it's opened up whole new worlds to music therapists. So I'll go ahead and tell you a little bit about music therapy, and then I'll tell you how SoundBeam is changing that field. Music therapy is not new. It really started in this country after World Wars I and II at VA hospitals, when volunteer musicians would go into those hospitals and play music to soothe and to heal those patients. Over the years, the profession has definitely grown, and now in universities across the country, there are music therapy majors. You can get a bachelor's degree in music therapy and then become certified and be a healthcare provider. You can also get a master's and even a doctorate degree at some institutions in the United States. Music therapy is really also very big in the UK, and the UK actually brought us the SoundBeam technology. So let me show you some music therapy in practice. This is a music therapist working with a child with physical disabilities. This music therapist actually is working with two children who have suffered brain injuries to rehabilitate. She's using music to do that. This music therapist is working with this cancer patient who is receiving treatment. You see a music therapist there working with an elderly patient. Music therapists often work in adult care facilities, daycare facilities, and in retirement homes and nursing homes to rehabilitate and soothe patients. You even see a music therapist here at the bedside of someone having surgery, because music has been, studies have supported findings that music lowers blood pressure and lowers heart rate and actually reduces bleeding in surgery. So music therapy is quite a big deal. It's actually some insurance companies are now covering the cost of music therapy, which that's a sad way to determine what is and what is not medicine, but we have found that in this nation, when private insurance companies will cover the cost of a medical treatment, then it's been tested and retested with certifiable benefits. So that's a little bit about music therapy. This is what a patient said about SoundBeam music therapy. He said, "I forget for a few blissful minuets the physical disability which has taken up far too much space in my life. Playing SoundBeam is pure magic." So let's go back to the image of SoundBeam, and I'll tell you how it works and how it has really revolutionized music therapy. SoundBeam, like I said, was invented in the UK. It's an absolutely touch-free device, so the patient makes no contact with the instrument at all. It works on sensor technology, so even the slightest movement will trigger this apparatus, even a movement so slight as the blink of an eye. And once that sensor is triggered, it translates into, converts that movement to sound. So SoundBeam is used in schools and colleges. It's used in dance studios. What I want to talk to you about is the special education and music therapy applications. Here you see a patient using SoundBeam. These are touch pads if the patient is able to actually touch, control motor movement, but also for the sounds that she can't control contact, you have this receiver, and every movement she makes is translated into a sound that she can hear. So that gives her a lot of control. In the past, music therapists would take transportable instruments like guitars into medical settings, and they would play for the patient, which had lots of benefits. SoundBeam makes it possible for the patients to also make music. So I have some interesting videos here that I wanted to share with you of SoundBeam being used. Now there's no voiceover, so I'm going to go ahead and continue to talk and give you information. You see a patient here. Now he's not touching that to make the sound. His movement makes that sound. This gentleman is playing in ensemble with conventional instruments, acoustic instruments. You hear some drums and other things in there. He's playing the keyboards with just the movements of his hands. So this enables a physically impaired musician to play with other conventional musicians in ensemble. This little boy, such a great story. I had to pull up another video of him. He came in for treatment with very little response. And you see...
In special education, for example, Soundbeam is recognized as a key resource in assisting children with disabilities, like Matthew here. Previously very difficult to reach,
Second session.
one of his first encounters with Soundbeam.
Not very responsive.
Some months on, he's made the connection between himself and the sound.
So he knows he's creating this sound.
Discovered a joyful experience of agency and control has significant implications for Matthew.
It's really neat. So you see him with a joyful realization that he is able to make that sound and that music. Let's move on. This patient, an elderly lady that they described as disaffected, so she was very combative, and she's also hemiplegic, which means that she has no movement on the right side of her body. That was her medical diagnosis, or so they thought. And then they came in and allowed her to use Soundbeam, and look what happened. She's moving her right arm, and she even registers some amount of surprise when she realizes that that right arm is moving. See the surprise on her face? She's looking at her hand. This gentleman is a trained musician with a disability that looks kind of like multiple sclerosis or something like that. He was quoted in another video saying, you know, I'm a classically trained musician and I remain so frustrated that I can't make music anymore, but Soundbeam allows me the freedom to express myself musically. There's the Soundbeam receiver. This man, young man, he was described as highly hyperactive, very short attention span, and when he got connected to the Soundbeam system, they found that he had a very advanced sense of musical phrasing and musicality, and they said that this is actually the longest he's ever concentrated on anything. So his therapists, caregivers were amazed. He loves to do the trills. This is the same young man dancing. He's creating all of that music with the movements of his body. Now you see this patient playing along with a traditional instrument. This is a soprano saxophone. So she's able to play Soundbeam with a conventional instrument. So there's that. I hope you've enjoyed learning about Soundbeam today, and that it has inspired you to learn the exciting technologies going on in the field of music therapy today. Thanks.